I'm Dr. Susie, and today we're going to talk about the TMJ, or temporomandibular joint. We have one on each side, right in here and right in here. Your jaw joint's kind of like a bucket handle. It has condyles that open and close and go side to side. People complain of TMJ dysfunction. That can start in a bunch of different ways. One, the first cause is people tend to chew on one side. So you're working one side and the other side doesn't work, and it kind of makes the bucket handle a little crooked. Another reason is trauma. Say you're out there playing softball or baseball and you get like a baseball to the face, it's going to hit your jaw and knock it out of line. An additional problem that promotes TMJ dysfunction is really bad posture. Turn to the side this way. When you have a forward head posture like this, it puts a lot of stress on the joints here, across the top of the shoulder and into the neck. And oftentimes people get TMJ problems. Another problem is, I think I talked about chewing on one side of the jaw, chewing gum. Sometimes dental work, when you have your mouth open and they're working in your mouth, it can create a TMJ imbalance. A lot of times when people are gum chewers, it's more the tight muscles inside the mouth and outside. The TMJ muscles are up here in the temple, in the jaw and here, and if you open the mouth, they're way back inside here. I don't stick my finger in there, but I give some people really good stretches to stretch all that musculature. Oftentimes though, because the TMJ is a very sensitive joint, there's a lot of nerve endings inside, oftentimes the TMJ joint is the last joint I adjust with a chiropractic manipulation. Let me explain why. Oftentimes when you go ahead and you adjust the neck up in here, it changes the pressure on the jaw. Your first vertebra is here, your TMJ is right in here, so they're very close in proximity, and if there's muscle spasm up in this area, it affects the jaw. So when I go ahead and adjust the top vertebra up in here, it takes a lot of pressure off the jaw. A lot of the rehab exercises I give are geared towards getting the posture better, getting the shoulders down and back, the chin back and down. Actually put your TMJ, your jaw, in an optimal place to work. I actually have a patient that when she sits in her normal posture, her jaw pops and clicks. But when she picks her posture back, it stops popping and clicking. So to adjust the joint, it's a very simple adjustment right in here, very minute amount of motion, just a really quick type of adjustment. You might get a little pop sound, and oftentimes somebody who's having TMJ problems, it'll resolve very quickly. Another thing that we tend to do is with people will have a mouthpiece because they brush or bite down at night. That creates a lot of tightness in the muscles in the jaw. So people tend to have a lot of headaches with that. TMJ can give you a ton of headaches. It can give you neck pain. It can give you ringing in your ears because the muscles are all close. It can give you shoulder pain. It's usually that type of scenario when someone comes in and complains of a TMJ problem. You'll notice a TMJ problem because when they open their mouth, their jaw is crooked. It doesn't open wide. It kind of deviates. Sometimes it opens and just goes to one side. Sometimes it opens and creates a little S shape when you try to open it. It's because either there's a problem with the capsule or the disc inside, or the muscles are out of balance. So chiropractically speaking, just to reiterate, we'll give stretching exercises, we'll evaluate the neck and the shoulder and the upper back, we'll evaluate the musculature and the function of the jaw. We can adjust the jaw, we can definitely adjust the neck. We give a lot of rehab exercises. They're a lot of fun. One of my favorite exercises is to have the patient open their mouth as wide as they can. Force your tongue out all the way. That is fun to do, especially when you're in a mixed crowd. But it stretches all the muscles inside the mouth. That's one exercise. And like I said, we gear towards getting proper posture as well. Thank you very much. And that's the TMJ dysfunction.